Good afternoon, everybody. I am very pleased to have my batchmate Dr. Fatima here in the crowd. We studied together in Grand Medical College in Mumbai 35 years back. Coming back to the topic, I have been asked to elaborate on the subject as well as the book, and especially lots of questions. Everybody whom I met, from the reporters or from people, the first question is, why did you write this book? It was a personal motivation and social motivation. In 1988, I started my practice in Lasalgaon, a small town in Maharashtra, in district Nashik. I was motivated by influence of Baba Amte, who was a social worker in Maharashtra, and I left the city and joined the rural area along with my wife. She is an anesthetist. And I did it for the job satisfaction of medical profession. Medical profession is a noble profession. Everybody knows, but everybody doubts nowadays. Really, I tell you, the people who join medical college, the medical profession or education is such, the subject is such, that you are taken over by the noble profession. Very rarely, person can only think of money when treating the patient. It is an entirely distinct by itself a profession. And I went to the rural area for my satisfaction. I went to the rural area where I will be able to do cesarean when, if I was not there, the patient has to go to 70 kilometers away to Nashik to get the gynecologist. And I did that. For the first 10 years, it was a wonderful experience of my life. Means, there was total faith on me. And that helped me. There was no blood in Lasalgaon. Nearest blood facility was at Nashik. It used to take 8 hours for first bottle of blood to come back. There was no blood, there was no physician, there was no pediatrician, but people have faith. I could operate on the patient with a uterine rupture without blood, with the hemoglobin 6 gram, only because patient had faith on me. And she survived, the baby survived. I was practicing happily. But this was not to be. Gradually, the virus of the commercialization starts spreading around, and the whole atmosphere changed. The trust started vanishing. The faith started going out. I started realizing the different waves. The people who were sending the patient happily to me started convincing the patient and to go to Nashik far away. There was a frustration, not because I did not get patient. By now I was having my direct practice. It was a frustration when patient used to come and tell me, at the thick of the night, my wife was obstructed, I went to such and such doctor, he sent me to Nashik, my expenses were soaringly 40,000 rupees that time, and I lost my baby, and caesar was to be done. Why that doctor did not refer me to you? Incidentally, this happened because patients used to come to know that I was around later, and somehow they used to come with another patient and they used to tell me the stories. For the simple reason that I did not give commission, I lost one baby. She was a cis gravida, first 5 children were fresh stillbirth. And this patient was a very poor, and I had accepted that whatever she will give, I will accept in the monetary form. But she needs to do caesar because the baby was breech. And there is a chance she could have delivered normally, but their baby could have died. The mother was convinced, when the woman was convinced, her mother was convinced, but the doctor, a general practitioner, instigated the relatives and asked them to shift the baby, shift the patient. The patient was taken away out from my operation theatre to a very unqualified practitioner, and next day I don't ever forget the crying to both women coming back to me, crying and saying that we have lost our baby. Now I started questioning what am I getting, means I never expected these things. The whole commercialization. One gynecologist told me very smilingly and very jokingly and very casually, Arun, what you are bothering about people's reaction, because there were incidences when mobs attacked the doctors. And I was also fearful. There is nothing written on my forehead that I am an ethical doctor. Anything can happen in my operation theatre. My wife started getting trembling. Then one doctor told me, why you are afraid? Come on, yaar, this is a business now. It is no more a profession. You should also not be a fool and live in your make-believe world. Come out of it. Come out. I said, but I don't have money to pay. If people ask me, they started demanding for any complication or death, 2 lakhs, 3 lakhs, 4 lakhs. And I had not that money with me because I never charged that much. He said, oh, come on, yaar, you start charging. You start increasing the turnover. And keep your 4 lakh rupees in your pocket. Throw them to the crying husband. They will shut up. Don't bother. This is not the medical practice which I would want to do and never wanted to get exposed to. And that was the point when I thought that whether I should leave Lasalgaon, whether I should stop practicing here after 20 years. I was getting patients. Monetarily, I was well off. I was having enough, because by the time, after 20 years, you get one pool of your patients. Problem is I got threatened by all the instigation of commercial doctors around. There was anger for me because I never gave commission. The soaring of this atmosphere, the trust, the faith, and the patient suffered. And they told me later. And this is what actually frustrated me. And then one day we took the decision that no longer I am sure that I can survive with my all moral intact. Means I can, once, there were 3 cases of postpartum hemorrhage death in my hospital in 21 years. First 2 cases, patients did not do anything. They were just thanking me. They said, you did your level best, doctor. What can you do else? And they took the patient away. But as the thing changed, as the commercialization has invaded everybody, including the patients, including the politicians, including the so-called leaders, the mafia started getting generated. They were looking for doctor to get a complicated case for him and pin him up and do settlement. This is happening everywhere, from cities to rural areas. And conscientious, rational, ethical doctors are suffering. They are afraid, they are fearful. The 3rd case died, and my antenna was alert, and I did the postmortem for her. And that saved me. Because there were approaches, whether we should settle, doctor. I said, there is nothing to settle. And the worst part or best part of it, the woman who died, her mother was a nurse who was referring patients to me for 21 years, and she was with me in labor room and she conducted the delivery. Means, she was telling me that, doctor, please don't do postmortem. I know. I was with you. I delivered the patient. I am a nurse. I said, no, I had nothing doing because you are relatives, I don't believe. And I did. And a doctor instigated mob, and that mob came on attacking me, and wanted money. That's all. When I refused, fortunately, with the all moral standing, and nearly 70% of the mob were my patients ones, I could survive. But then I realized that the time is up. Rational doctors, as a rational doctor, I cannot go on. And I left. And I joined Sati, which is acting on the health advocacy issues, and we are fighting for the patient rights, as well as we are fighting for the accountability of the public healthcare system and private healthcare system. I said, yes, this is the section which I want to work, because I am equally concerned about the fate of the rational doctors in India, and forget about our batch, forget about 30 years seniors. I am looking to the youngsters coming in.